In today's news, who to blame, who to blame. Controversial private health insurance proposal halted as the government and opposition play the blame game.
Young, prominent Virgin Islands businessman Daniel Danny Hamm passes away.
We also see ferry travel to the sister islands resuming at the Road Town Jetty from this Sunday.
Also, Health Minister the Honorable Carvin Malone is considering more incentive for the vaccines as the USVI prepares to launch a $1 million vaccination lottery.
We also see the BVI's COVID-19 vaccine efforts to receive more UK support. Mr. Hon Carvin, the UK Healthcare Ambassador, was in the territory recently. We have all the details for these and so much more when 284 News returns.
The win.
What are the health
I'm freaking out.
Jet
is about these people.
It's always a pleasure coming to you live and direct from the
What's poppin'? What's really good?
Davis has won it for the Lakers.
Welcome, everybody. It's Wednesday, June 9th, 2021. Indeed, it has been a wet Wednesday outside. I'm Ron Grant.
And my name is Javon Wilson. The rain is doing its thing, but we have our business to do as well. So we are here to deliver your daily dose of local, regional, as well as international content right here on 284 News. My name is Javon Wilson, and I'm so happy that you could join us. Now, topping our headlines today, we first of all want to give a quick birthday shout out to our very own Natasha Klein, very well known as Tassie. Today is her birthday, and we want to say happy birthday. She's always tuned in here at 284 News. So, of course, we want to wish her all the best. As we move on, less than 2 months after the rerouting of the domestic ferry travels to the Cyril B. Romney Tortola Pier Park, the BVI Ports Authority has now announced that all domestic travels via ferry will now return to the Road Town Jetty this Sunday, June 13th. Now, the June 9th statement out of the Ports Authority stated, and I quote, health and safety protocols have been put in place and structures have been established to ensure the safety of both domestic and international ferry passengers as they utilize the seaport, and added that the present schedule for both domestic as well as the international ferry passenger operations will remain the same. Now, Ron, we do know that the initial rerouting definitely sparked some concerns within the community, but it's really quite refreshing to see that we are back in order.
Indeed. And also, BVI might limit the number of each nationality allowed in the territory, believe it or not. BVI deserves more mature leadership, says Skelton Klein, and COI not going so well. It is too disruptive to my ministry, says the Honorable Labor Minister Vincent Wheatley, and over $1 million worth of requests for help as COVID-19 continues to strangle the BVI economy.
Wow, viewers, we're going to head straight into today's newscast. Now, over the last few days, we've seen it. Members of the BVI population have been bombarded with the ongoing debacle regarding a proposal to afford current and former legislators comprehensive private insurance. Now, in light of the public contention and what some may consider to be a desperate fight for political points, Acting Premier and Minister for Education, Culture, Agriculture, Fisheries, Sports and Youth Affairs, as well as the member for the 7th District, Dr. the Honorable Natalio D. Wheatley, has now announced the government's decision to halt the process. Now, Honorable Wheatley, within a detailed press letter, said, and I quote, notwithstanding the political pandering and the flip-flopping from the opposition and the overall facts as have outlined above, your government has taken a decision to halt the tender for the insurance service for current and former House of Assembly members so that we can have further deliberations among the members of the House of Assembly and also to consider the views of the public on the matter. Now, viewers, both Dr. the Honorable Natalio Wheatley and at-large member and Junior Minister for Tourism, Honorable Shari de Castro, have called out Honorable Melvin Mitch Turnbull on his duplicity, condemning what they said is a deliberate effort to score cheap political points for the opposition and, of course, toy on the public's emotion. Now, Honorable Wheatley reiterated within his letter that the 2nd District representative not only attended meetings and gave his stamp of approval, he also spearheaded the project. He said, and I quote, the member for the 2nd District throughout all of this has not been a silent observer, nor has he been excluded, or absent in any way. The member for the 2nd District has been front and center, participating actively in carrying the insurance matter forward, particularly in his role as the lead member in light of his expertise on the subjects. No objections or reservations were heard from the member for the 2nd District until after the matter became a subject of the news reports and public commentary, where he now claims that his position was to wait until the NHI amendment and for a study to be done, said the acting premier. Now, viewers, get this. The Honorable Natalia Wheatley also revealed within his letter that Honorable Turnbull made no objections even at a recent meeting. That meeting was held on June 7th, which was convened by the HOA to discuss the facts and matters as witnesses were even called in. Honorable Wheatley said, and I quote, "At that meeting, it was confirmed by the procurement officer that she did not get any impression from the member of the 2nd District that the tender 5 process was to be halted pending any report from the member for the 2nd District or any objections at all, as the member is today claiming to have harbored. The officer confirmed that the member for the 2nd District's constant and full participation and that the member was scheduled to actually appear on behalf of the House of Assembly for the pre-tender meeting scheduled for today, Wednesday, June 9th, 2021. He said the facts are established, show that the honorable member for the district is being duplicitous and disingenuous, and that the honorable leader of the opposition is complicit with him in trying to mislead the public," the minister continued. Now, viewers, as the fiasco continues, one truth becomes very clear. All 13 members of the House of Assembly were not only privy to, but also seemingly approved the proposal that would provide supplemental insurance to current and former politicians. Now, why is this a problem? Well, viewers, the residents of the Virgin Islands are forced to use a national health insurance, which in many cases limits coverage. When the National Health Insurance Scheme came into effect back in 2016, many residents of the Virgin Islands were forced to be limited to NHI as it is mandatory, and many corporations chose to exit their private health insurances. And now, for years, we've seen NHI being widely condemned as residents call on successive governments to review and revamp the systems. Residents are often seen launching GoFundMe pages to assist with dire medical emergencies, as we've seen quite a number of times. So questions as, why not fix the current system? Why do politicians deserve medical care than what is being provided to the average citizen who is currently underserved by NHI? Why are our politicians securing only themselves in the midst of a global crisis? Viewers, these are the questions being echoed throughout the territory to the government and the opposition, both of whom are being held responsible and simultaneously trying to excuse themselves from the integral role played in bringing this proposal to the public domain. Ron, the conversation continues.
Yes, it does.
Here we see the acting premier, which is our deputy premier as well,
yes,
weighing in on the conversation. Just yesterday, Honorable Shari de Castro as well, and many persons coming to the forefront, essentially to cast blame. But I think it would be remiss of us to deny the fact that all members in the House of Assembly played a role and should take responsibility for what's happening.
Every single 13 members of the House of Assembly. It's interesting when we go through the Honorable Natalia Wheatley's statement, the Honorable Natalia Wheatley, he said, and I quote, "Your government has taken a decision to halt the tender for insurance service for current and former House of Assembly members so that we can have further deliberations among the members of the House of Assembly and also to consider the views of the general public." Let me just pause right there, viewers. Had we done that prior to, we would not be in this situation.
Exactly.
So I want the general public to really understand the unwarranted disrespect and lack of consideration for the general public. Again, like we discussed yesterday, it's only when the general public kick up a storm and kick up them foot, that's when people want to listen to what you have to say.
Right.
That's not how it works, guys.
Right.
And I wish that we could get to a point where we're really and truthfully, as honorable members, as public servants, when we say we're considering the general public's thought process and what they're going through, I really wish that we could hold ourselves accountable to that. Viewers, we're moving right along with some very sad news. Danny Hamm, a young, prominent Virgin Islands businessman, has passed away. Hamm died early this morning, June 9th, 2021. He was the owner of Danny's Bar in Johnson Gut, Tortola, BVI, a well-known business in the 6th Electoral District. Now, in an invited comment, the Royal Vigilance Police Force said, and I quote, "The Royal Vigilance Police Force received the report of a sudden death early this morning. No details are yet available." Now, in a Facebook post, the Honorable Alvar Maduro Keynes issued a message of condolences to the family of the late Daniel "Danny" Hamm. She said, and I quote, "I'm deeply saddened to be awakened by a text message that broke my heart with the news of the sudden passing of Danny, as he was affectionately called. Young Danny was so full of life, a great smile of welcome each time, and a passion for business and mechanics. He was a part of the bustling life on the corner of Johnson Gut and a very much well-known and well-liked member of the 6th District. As a mother of 2 young boys close to his age, my heart aches for his family and mother, Renard and Cynthia Hamm. I'm so sorry for your loss. To the entire family and especially his brother, my family and I will pray for your comfort at this time. I ask the community to bear them up in your prayers when possible. Visit and comfort the family. Losing Danny will be hard on all of us. He will not be forgotten." Of course, Jovan 284 Media extends our deepest condolences to the family of
Really
Mr.
sad.
Hamm as we continue to reverse. Life is very short,
Yes.
but one of the things that is uncertain when you look at pivotal persons throughout the community who have enriched and really engraved the business community when it comes to small business. Here's a local businessman who will no longer be with us, but I think his legacy will definitely live on.
Certainly, he left an indelible mark. And again, we want to extend our deepest condolences to the family and friends. I know so many persons have been pouring out their support
Yes.
to the family and friends of the deceased. And of course, we pray that you guys are comforted in this time.
All right, viewers, still ahead, the BVI's COVID-19 vaccine efforts to receive more UK support. Ian Cummings, a UK Healthcare Ambassador, was in the territory, and we had an opportunity to speak with him. And also, ID reinforcement at the Bats and Devil's Bay National Park has been linked to abuse suffered by staff from visiting persons. We have the details of all of this and so much more after a word from our sponsors. You're watching 284 News.
Is business slow? Cash flow down? Hosting an upcoming event? We can help. Advertise with 284 Media and take your business or event to the next level by enhancing your present marketing and messaging strategies. Allow our team of experts to create a personalized ad that sets your business apart from all the rest. This could be your business or event. So, what are you waiting for? Contact our marketing team at 284media@cctbvi.com. Advertising with us works.
Viewers, welcome back to 284 News. Now, more on the local scene. We do see the recent enforcement of valid identification at the Bats as well as Devil's Bay National Parks by the National Parks Trust has now been linked to reports of abuse suffered by some of the ground staff. Now, this was revealed in a recent 284 Media interview with the director of the National Parks Trust, Dr. Cassandra Titley O'Neill. Our Kamal Haynes has the story.
According to the law governing the national parks of the territory, residents, citizens, and belongers can access the national parks of the territory free of charge once they provide identification that confirms they are among the qualified category of persons. All other persons are subject to a $3 entry fee. The director of the National Parks Trust, Dr. Cassandra Titley O'Neill, said she received several reports of incidents where persons entering the baths were being verbally abusive towards her staff after being asked to simply present identification to prove that they indeed qualified for free entry.
When the bats was acquired from the O'Neill family, one of the land covenants was that only BVI landers or persons who deemed to belong to the BVI should not pay. A decision was made by the board around 2003 or so, who felt that the administrative burden of having BVI landers walk with a passport to present and to show themselves was a great burden to the staff. And as of late, we've been having a lot of instances where people are telling you, oh, I am from here, I live here, XYZ. And so just to clarify and to not have persons being belligerent to the staff, we are now enforcing that persons follow the regulations as stated in the 2008 regulations so as to avoid any confusion and misconceptions of the fee and what are the requirements in order for you to pay to not have to pay the $3 fee.
The director said that the enforcement was necessary to protect her staff from future abuse and implored all persons to simply comply with the requirement.
I check in I live on Virgin Gorda. I check in from time to time on the weekends, sometimes during the week, and I've been getting more and more complaints. And so for me, my staff are my front line. It is important for me as a director to understand their concerns and the challenges they're having in the workplace and try to minimize them as much as humanly possible so that they can effectively carry out their duties. And so we're just imploring all persons, you want to not pay the $3 fee, please walk with a valid ID. And the valid ID has to have a picture and expiration date, like you already previously stated, so that we know that you are operating within the legal constraints of the country as well.
Dr. O'Neill also revealed that measures are in place for those persons who opt not to comply with the mandatory stipulation.
We've had situations, not just with the entrance fee, we've had situations with persons actually illegally fishing within the parks, which is also noted in the regulations. And in situations like this, the staff has already been advised to take a picture of the person, and then we'll follow the necessary steps as outlined in the regulations.
All persons who fail to provide a valid form of identification and opt not to pay the $3 entry fee are liable on summary conviction to a fine up to $5,000 or imprisonment for a term not exceeding 6 months or both. Kamal Haynes reporting for 284 News.
We do know that it is critical that we continue to protect that ecosystem that really buys into our tourism product. And here we see with the new levels of reinforcement that are required by our National Parks Trust, we see that really affecting the staff over there at the Baths and Devil's Bay. We're just hoping that the public can really comply with the rules.
Absolutely. Now, moving right along, the government of the Virgin Islands continues to receive support from the United Kingdom in its COVID-19 vaccine campaign, and it's presently hosting a visit from the UK Healthcare Ambassador to the overseas territories, Professor Hon Carvin. Chief Medical Officer Dr. Irad Potter stated that providing more information and answering questions from residents as needed given the territory's current situation with COVID-19 vaccine hesitancy. Professor Cumming has an extensive schedule of media interviews, stakeholder meetings, and of course community meetings to further support the public health initiative. The UK Healthcare Ambassador career began in the National Health Services, working in collaboration disorders really before moving into healthcare management career into the 1990s. He has held a variety of general management posts, including over 11 years as the chief executive of a large hospital group, 3 years as the chief executive of the NHS Healthcare Commissioning Organization, and 3 years as the chief executive of the NHS in the West Midlands region. Now, in parallel with the NHS career, Professor Cumming has a long history of working with the education sector, including as the NHS led for the establishment of Lancaster University Medical School and developing, of course, a running leadership and management development program for clinics. Professor Cumming also has extensive experience in major incident leadership and management, having led at either tactical or strategic level the response of a large number of incidents, including several multiple trauma incidents, the UK's largest ever outbreak of disease in 2002, and of course the flu pandemic in the West Midlands in 2009, and the Birmingham riot in 2010. He was also the NHS lead for the response to the Mid-Staffordshire NHS Trust Quality of Healthcare and scandal from 2010 to 2012. Now, Professor Cumming, viewers, was in studio for an interview on the present vaccine program in the BVI. Take a look. Here, Ambassador to the overseas territory. Mr. Cumming, welcome to 284 Media, and of course, welcome to the British Virgin Islands.
Good afternoon, Ron. Thank you very much indeed for the invitation to be here today.
You're most welcome. The AstraZeneca vaccine, of course, and the fight against COVID-19 vaccinations have been a topic of discussion here in the territory of the Virgin Islands. The AstraZeneca vaccine is what is available to us. We're going to ask a few questions as it pertains to the vaccine, its safety and efficiency. But from your perspective, I want you to begin by telling us about the national vaccination program from your standpoint. Where are we?
So there's some brilliant work being done here in the Virgin Islands to ensure that as many people as possible take the vaccine. But you know, there's more we can do. There's definitely a degree of vaccine hesitancy. And I think that's down to the fact that people have a low perceived risk of COVID, the actual disease, and a high perceived risk of vaccine. Unfortunately, neither of those are correct. I've been present in many countries where tragically people have been dying in hospitals and in nursing homes from the effects of this virus. And also, I've been present in many countries to see the vaccination programme roll out, particularly Gibraltar, where over 90% of the adult population have now taken the vaccine. And I've been able to see at first hand the protection that's been offered to the population as a whole and individuals.
Okay, talk to us about the safety of the AstraZeneca vaccine. Of course, we've been hearing a lot of skepticism. Persons have their thoughts, and I think the perhaps skepticism is lending to many residents not wanting to take the vaccine. From your seat, tell us about the safety and efficiency of the vaccine.
So many things that we do in healthcare are about replacing one risk with another. So if I were to develop appendicitis and go to hospital, I wouldn't think twice about having an anaesthetic and having surgery to remove my appendix. Because if I didn't have that surgery, then my appendix would rupture and chances are I would die from widespread infection. Now, in having an anaesthetic, there's a risk. In having surgery, there's a risk. But those risks are lower than the risk of dying from the actual disease itself. It's just the same with vaccination. There is a tiny risk with the vaccine, but there is a much, much greater risk of actually dying if you contract COVID. Some 34 million doses of the AstraZeneca vaccine have now been given in the United Kingdom. 32 people are believed to have died from blood clots associated with the AstraZeneca vaccine. So that's roughly 1 in 1 million people.
Correct.
222 people have become poorly with blood clots associated with the vaccine. But a risk of 1 in a million, your risk is so much higher of catching COVID and dying from COVID. And by the way, with COVID, it's quite often blood clots that kill you. So this is about how do we reduce the risk to an individual and how do we develop immunity in the population. There are only two ways to get immunity to a disease. One of those is by actually catching the virus, in this case itself. The second way is to be vaccinated. You will not develop immunity simply as time goes by. We don't want there to be an outbreak here in the Virgin Islands, such as they've recently seen in Anguilla or Bermuda, for example, where tragically people have been in intensive care and lost their lives, for people to realise that they need to take this vaccine.
In the territory of the Virgin Islands, we have seen one unfortunate death and many recovered cases, as you know. But again, there are still persons that are apprehensive. We do have the vaccine that is available. The time is running out, however. The clock is ticking. What would you say to persons who are still apprehensive and have the availability of the vaccine here in the territory? Why should they take this opportunity and be vaccinated?
So I have been vaccinated, my wife has been vaccinated, my children are about to be vaccinated. I personally believe that this vaccine is safe. I believe that we wouldn't be offering it around the world if it wasn't safe. As of yesterday, we passed the global milestone of 2 billion doses of vaccine being given worldwide. We have seen no significant major numbers of side effects resulting from that vaccine. This isn't just about keeping you safe. This is about keeping the whole population safe. It may be, if you're young and fit and healthy, you have a very minor form of COVID, even if you have any symptoms at all. But you know what? You could pass it on to your parents. You could pass it on to your grandparents. I was present in Gibraltar when the virus got into nursing and residential homes for older people, and we were watching 50 and 60 people die over a 5 or 6 week period. And these were people who were sitting up in bed talking 1 minute, 2 to 3 hours later they were dead. We do not want that to happen in these beautiful islands. And the best way to protect yourself, your family, your colleagues, and the whole population of the Virgin Islands is to become vaccinated.
Viewers, that was Healthcare UK out of the UK. Mr. Ian Cummings drove on the healthcare system across the region, especially coming out of the UK, has been really pushing for persons to get vaccinated. But I want to encourage us really as a territory to understand the importance of not only understanding the right of persons to get vaccinated, and we understand the ramifications, and just like Professor Cummings said, that where it can move us into, a better position. But it really, I think it should, at the end of the day, be up to individuals to make that decision. So we want to continue the education, and we thank him so much for coming to our studios.
All right, viewers, as we move on, we look across the water's neighboring territory. The U.S. Virgin Islands has now announced plans to launch a vaccine lottery in July, where a total of $1 million is expected to be given away within a 10-week period. Now, this is according to an article published by the VI Consortium on Monday, June 7th, which said that the lottery is an initiative by the USVI government to persuade more persons to get vaccinated. The letter said, and I quote, "The vaccine lottery will start on July 7th and will be paid for utilizing federal dollars provided to encourage inoculation. Importantly, everyone that is vaccinated, including those who choose to take the first shot, the shot between now and July 7th, will be eligible to win," the article stated. Now, the goal of the lottery is to give away $100,000 to a single person every week for a period of 10 weeks until the $1 million has been fully utilized. Now, the article further revealed that the USVI Governor, Albert Bryan, made a decision to launch the initiative after it was observed that the territory's pace of administering vaccines had started to dwindle, stalling at around 40,000 vaccinated persons. Governor Bryan has said that his intended goal is to have approximately 50,000 persons fully vaccinated by July 1st. The USVI is not the only country to announce the use of lottery initiatives to boost vaccination numbers. In its mainland, we do see the states such as California, Colorado, and Ohio, all have launched multi-million-dollar vaccination lotteries. We even see just yesterday, Ron, within the Daily News in the U.S., marijuana joints being offered to persons who can prove that they took the COVID-19 vaccine.
And in addition to that, Jovan, in the United States, ammunition, actual guns, within West Virginia, I believe it is, have been offered. So
Yes. And now our very own minister, the Minister of Health and Social Development, Honorable Carvin Malone, took to social media after seeing this headline to question whether local government as well should also incentivize the vaccine. One resident said in response to him, and I quote, "Incentives to BVI citizens and residents to take the vaccine, would catalyze the reopening of the country, which is necessary because of the nature of the national economy. Considering the small size of the population, the policy would create a win-win situation given the benefits that would accrue all around without too much work to immunize everyone in the country," end of quote. Now, another resident opined, and I quote, "People would take the vaccine with or without an incentive. Our money can be better spent elsewhere. I think the BVI government needs to use our monies to provide a more suitable living environment for the citizens and residents of our territory. Fix our schools, fix our roads, improve the quality of life, reduce the high cost of living, make land more accessible for our people, provide more working opportunities for us, just to name a few. To the private businesses, they need to use that money to increase wages for their staff, vaccinated or not. People are struggling." Very different comments coming from members of the populace in response to Honorable Carvin Malone's post on Facebook questioning the public on whether the government should incentivize vaccines. Now, Ron, we've seen it all, clearly. Yes. Again, one thing is for sure, when you look at the health experts' effort to convince the public of the benefits of the vaccine, clearly it's not enough. Yes, we have heard reports of the vaccines that were due to expire soon enough being used up. Just the set for July needs to be utilized now, which is a good thing. But here we see a desperate push to get persons vaccinated.
And we're going to continue to see it, and we will, of course, viewers continue to follow the story. But that brings us to the end of our newscast. We are so honored, as always, to bring you your daily happenings, both locally, regionally, and internationally. We are 284 News, your source for honest and impartial news, right out of Road Town Tortola in the beautiful British Virgin Islands. I'm Ron Grant.
And my name is Javon Wilson. Once again, thanking you for joining us. And again, you are free to join us once again tomorrow, the last day of the working week, as we head into a very long holiday weekend. So until then, take care. Bye-bye.